1,221 days ago, WHO learned of a cluster of cases of pneumonia of unknown cause in Wuhan, China. On the 30th January 2020, on the advice of an emergency committee convened under the international health regulations, I declared a public health emergency of international concern over the global outbreak of COVID-19, the highest level of alarm under international law. In 3 years since then, COVID-19 has turned our world upside down. Almost 7 million deaths have been reported to WHO, but we know the toll is several times higher, at least 20 million. Health systems have been severely disrupted, with millions of people missing out on essential health services, including life-saving vaccinations for children. It has caused severe economic upheaval, erasing trillions from GDP, disrupting travel and trade, shattering businesses, and plunging millions into poverty. It has caused severe social upheaval, with borders closed, movement restricted, schools shut, and millions of people experiencing loneliness, isolation, anxiety, and depression. COVID-19 has exposed and exacerbated political fault lines within and between nations. It has eroded trust between people, governments, and institutions, fueled by a torrent of mis- and disinformation. And it has laid bare the searing inequalities of our world, with the poorest and most vulnerable communities the hardest hit, and the last to receive access to vaccines and other tools. This is a moment for reflection. As a global community, the suffering we have endured, the painful lessons we have learned, the investments we have made, and the capacities we have built must not go to waste. We owe it to those we have lost to leverage those investments, to build on those capacities, to learn those lessons, and to transform that suffering into meaningful and lasting change.